So you've probably seen the blue puzzle pieces. Maybe you've watched a documentary or two. Maybe someone in your life was just diagnosed, or maybe you were just diagnosed and you typed in "what is autism" into YouTube at 11 p.m. because you just didn't know where to start. Here's the thing. Most of what we collectively know about autism is either incomplete, outdated, or just flat out wrong. And that matters because when we misunderstand autism, we misunderstand autistic people, we misdiagnoses, we withhold support, we send kids and adults the message that something is broken when nothing is broken at all. So today we're going to do something that Autism Awareness Month doesn't always actually do. We're going to get really accurate. We're going to talk about what autism actually is, according to the diagnostic criteria, in plain human language. Then we're going to take apart 4 of the most stubborn myths that keep autistic people from being truly seen. And then we're going to talk about what the diagnosis does not capture, because that part just might be the most important of all. Hi, I'm Dr. Colleen Sierra. I'm an ADHD psychologist and mom who combines research and lived experience to help you see, support, and celebrate every kind of mind. Okay, let's get into it. Autism spectrum disorder, or ASD, is the clinical term you'll find in the DSM-5. That's the diagnostic manual that therapists and psychiatrists use. And according to that manual, autism is characterized by 2 main things. Number 1, differences in social communication and interaction. This does not mean that autistic people are bad at connecting with other people. It means they communicate and connect differently than what our neurotypical centered world considers to be the default. So what does this look like in real life? It might look like taking language very literally. So if you say, "we should hang out sometime," but then you don't follow up with a specific plan, an autistic person might genuinely not know whether you meant that or not. It might look like less eye contact, or eye contact that feels forced and effortful rather than natural. It might look like struggling to navigate unspoken social rules, the invisible scripts that neurotypical people seem to absorb automatically, like when it's okay to interrupt or how long to small talk before getting to the point. It might also look like having very deep, genuine connections with a smaller number of people rather than a broad, easy social network, or performing direct, explicit communication over hints. None of these things are deficits in caring about people. They're differences in how connection is built and expressed. Number 2, restricted and repetitive behaviors, interests, or sensory experiences. This is the part that gets described in the most clinical and cold language, and it deserves a warmer translation. Restricted interests just means that autistic people have areas of intense and deep passion, not a passing hobby, a consuming love. Now, whether that's something stereotypical like trains, ancient civilizations, or Star Wars, or something that pop culture deems as normal like Taylor Swift, golf, or wine, it is the depth of the engagement that matters and is often extraordinary. Repetitive behaviors often refers to stimming, which is self-stimulatory behavior, which we'll talk more about when we get into the myths section. But briefly, stimming is how many autistic people regulate their nervous systems. It's functional, it can be joyful, and it's definitely not a problem that needs to be eliminated. Sensory experiences refers to the fact that many autistic people process sensory information differently, more intensely, or in ways that can be overwhelming or joyful. Sounds, textures, lights, smells, tastes. This can show up as feeling overwhelmed by these things or being drawn to these things. And for many autistic people, it's some combination of the two. This isn't pickiness or dramatics, it's neurology. Okay, so now let's talk about when does this show up. The DSM says symptoms must be present from early childhood, but here's something crucial. They don't always look like symptoms in early childhood, especially in people who are highly intelligent, who are socialized as girls, or who have become very skilled at masking, which means learning to mimic neurotypical behavior to fit in. We'll come back to masking in a future video because it deserves its own deep dive. So what this means practically is that a lot of people, particularly women, girls, AFAB folks, and people of color, go undiagnosed for decades. Some aren't identified until their 30s, 40s, 50s, later, or not at all. Okay, so now what does the autism spectrum actually mean? When people hear spectrum, they often imagine like a straight line from a little autistic to very autistic. And that's just not what the spectrum is. The spectrum is more like a color wheel. Every autistic person has their own unique profile, areas where they need more support and areas where they're extraordinary, sensory experiences that are challenging, communication styles that are all their own. Two autistic people can look completely different from each other and both be autistic, which actually brings us perfectly into the myth section. All right, myth number 1 is that autistic people lack empathy. And this one causes real harm. The idea that autistic people are cold, robotic, or unfeeling, that they simply don't have the capacity to care about other people's emotions, could not be farther from the truth. What is true is that there are some differences in how some autistic people process and express empathy, and that those differences are often misread by neurotypical observers as the absence of empathy, but that's just not true. Here's what the research actually shows. Many autistic people experience what's called cognitive empathy, the intellectual understanding of another person's emotional state, differently than neurotypical people. Some autistic people find it's harder to automatically infer what someone else is feeling based purely on facial expressions or tone of voice, particularly in real time, and particularly when they're also managing sensory input and social demands simultaneously. But affective empathy, actually feeling care and concern for other people, is often very much intact. In fact, some research suggests that autistic people can experience emotional empathy very intensely, so intensely that it becomes overwhelming. This is sometimes called empathy overload, feeling so much in response to someone else's pain that it almost becomes difficult to function. There's also a concept called the double empathy problem, which was introduced by autistic researcher Damian Milton, which reframes the whole conversation. The double empathy problem says that communication difficulties between autistic and non-autistic people go both ways. Neurotypical people often misread autistic people just as much as autistic people are accused of misreading neurotypical people. So it's not a one-sided deficit. It's a difference in the neurological style meeting another difference in someone else's neurological style. So when we say autistic people lack empathy, what we're often actually describing is a communication mismatch, not an absence of caring. Moving on to myth number 2, which is that autism looks the same in everyone. So when most people picture an autistic person, typically we are picturing something very specific, which is typically a young white boy who is either nonverbal or speaks in a very flat, monotone way, who lines up his toys, who is a savant in math or music, who struggles to make eye contact, and who has obvious visible support needs. And that picture is real for some autistic people, but it is not the whole picture, not even close. Autism presents differently based on age, gender, race, culture, co-occurring conditions, masking, and individual neurology. The stereotype I just described was built almost entirely on research conducted on young white boys. And for a long time, that very narrow picture meant that girls, women, AFAB folks, people of color, and highly verbal or academically successful people were routinely missed or misdiagnosed, often with anxiety, depression, borderline personality disorder, or nothing at all. An autistic woman might be deeply social, highly verbal, have a wide circle of friends, and still be completely exhausted by all of it because she spent her entire life consciously learning and performing social scripts that neurotypical people access automatically. She might get home from a social event and need 2 days to recover. She might have meltdowns in private that nobody ever sees. She might have been told her whole life that she's too sensitive or too intense or too much. An autistic teenager might be the kid who knows every single fact about every Marvel character ever and wants to talk about it for 3 hours, who struggles to transition between activities, who has a very specific way of doing things and gets genuinely dysregulated when that routine is disrupted, but who presents as quirky rather than autistic to most of the adults around them. Autism doesn't look a certain way. It doesn't have one face. It has millions. And the sooner we expand our picture, the sooner we stop missing the people who need support and understanding. Myth number 3, autistic people don't want relationships or are bad in relationships. This myth is connected to the empathy myth, but it deserves its own space because the harm it causes is significant. The idea that autistic people are loners by nature, that they prefer to be alone, that they don't need or want friendship or love or community, is false for a lot of people. What is true is that relationships, particularly relationships built around neurotypical social norms, can be exhausting for autistic people. The constant code switching, the unspoken rules, the small talk, the performance of social scripts that don't come naturally, the sensory demands of being in social environments, all of that requires significant cognitive and nervous system resources. But exhausting is not the same as unwanted, right? Many autistic people deeply want connection. They want to be known, loved, and understood. They want friendships and partnerships and community. What they often want is connection that doesn't require them to mask who they are. Connection with people who communicate directly. Relationships where depth is valued over breadth. Friendships that don't require constant maintenance through social performance, like texting constantly or constantly making plans. When autistic people withdraw from social situations, it's often not because they don't want people, it's because the cost of social interaction as it's currently structured is too high. That's an environmental problem, not a personal deficit. And when autistic people do find their people, their safe people, their real community, the connection is often profound, loyal, and deeply meaningful. Myth number 4, and our final myth, is that stimming is just rocking and hand flapping. So when most people think of stimming, they think of very visible motor behaviors, rocking back and forth, flapping hands, spinning, and yes, those are forms of stimming. But stimming is so much broader than that, and understanding it more fully changes how we respond to it, and maybe even changes how we think about ourselves. Stimming is short for self-stimulatory behavior, and it's any repetitive movement, sound, or sensory input that helps regulate the nervous system. It is not random, it is not meaningless, and it is functional. Stimming can look like tapping fingers, clicking a pen, twirling hair, chewing on a straw or clothing, humming, repeating phrases or sounds, rereading the same book, or rewatching the same show over and over again, listening to the same song over and over again, pacing, skin picking, doodling, etc. Does this sound familiar to anyone? Because a lot of people stim, autistic and neurotypical people alike. The difference is that for autistic people, stimming is often more intense, more necessary, and more visible sometimes, and it plays a critical role in nervous system regulation. Stimming helps autistic people manage sensory overload. It provides predictable, soothing input when the environment feels unpredictable or overwhelming. It expresses emotion, excitement, anxiety, joy, distress. It helps with focus and processing. Here's the thing that I need you to hear really clearly. Historically, autistic children were trained not to stim. They were punished for stimming through behavioral interventions that prioritized looking neurotypical over actually being regulated. And the consequences of that suppression, the internal dysregulation that builds when you remove something from someone's coping, that has been significant and harmful. Stimming is not a behavior to eliminate. It's indicative of a nervous system that needs to be understood. So we've covered what the DSM says autism is, and we've cleared up some of the myths that distort how we see autistic people. But I want to close with something that I think is maybe the most important piece, and it's the piece that the clinical criteria leave out almost entirely. The diagnostic criteria tell you what autism can look like behaviorally for some people, but it doesn't tell you who autistic people truly are. They don't tell you about the depth of passion that autistic people bring to the things they love, the loyalty, the directness that is actually a form of profound respect, because an autistic person who tells you the truth is choosing honesty over social performance and masking. The creativity that comes from a brain that connects information in nonlinear ways. The capacity for deep, sustained focus on things that really matter. They don't tell you about the grief of late diagnosis, the years of wondering what was wrong with you, the relationships that broke down because you didn't have the language to explain how you experienced the world, the exhaustion of decades of masking. They don't tell you about the relief that often comes with the diagnosis, the way that a label can become a lantern, illuminating your own history in ways that finally make sense for the first time, maybe ever. They don't tell you that autistic people have been building community, advocating for themselves, developing language and frameworks for their own experience, and that the neurodiversity movement, largely led by autistic people themselves, asks us to stop trying to make autistic people normal and start making the world more accommodating. Autism Awareness Month asks us to be aware, yes, and awareness is important, but I want to invite you to go further than that. Awareness without acceptance or understanding just doesn't move the needle. Understanding without acceptance doesn't change lives. What actually changes lives is building a world, relationships, schools, workplaces, therapy rooms where autistic people don't have to mask who they are in order to survive. That's what we're working toward, and I'm really glad you're here for it.